St. Charles nurses officially threatening to strike.
If management is committed to making profits on the backs of healthcare workers and understaffing the hospital so profoundly that it puts our community's public health in jeopardy, then we will do all it takes to ensure equity and justice.
The Oregon Nurses Association says that St. Charles hasn't taken the steps needed to recruit and retain more staff. St. Charles nurse John Nangle says the strike is not centered around the raise for nurses, but compensation packages have to meet Bend's cost of living.
Nurses are not able to move here. We've had nurses get hired at St. Charles, realize they could not afford to live here, and leave.
The hospital recently provided its nurses with a $5 raise, bringing the minimum hourly wage to $45 or nearly $95,000 annually. St. Charles says their average wage for nurses is $108,000, making it the second highest in the state. In a virtual press conference, Chief Operating Officer for St. Charles, Amon Simmons, says both sides agree on the hospital staffing issues.
St. Charles needs more nurses. We are actively hiring for many positions so that we can fully staff services, and we are excited to share that our recruitment efforts are paying off.
State House Representative Jason Kropp spoke at the ONA's press conference Friday morning in support of the nurses.
Preparing for a strike is not an action to be taken lightly, and I know our nurses are only willing to take this step in order to not settle for a bad contract that continues the status quo and endangers the health of our community.
St. Charles says upcoming negotiations will now be overseen by a federal mediator. The hospital says it is a standard in negotiations.
There's a national nursing shortage. It is not a problem unique to St. Charles. And having a workforce shortage in a critical function like nursing and healthcare requires a multifaceted approach to problem solving.
2 negotiating sessions are scheduled for Tuesday and Wednesday next week.